I'm about to show you something that will change your life starting tonight. 4 specific breathing techniques that can lower your cholesterol by 20 to 40 points without a single medication, without changing your diet, and without spending $1 on supplements. If you're dealing with high cholesterol that keeps climbing despite the statins your doctor prescribed, that makes you worry every time you get blood work done, that has you terrified of heart attacks and strokes, what I'm about to reveal could literally save your life. Your high cholesterol isn't just a number on a lab report. It's your body's warning system telling you that your stress response is broken, that your liver is overproducing cholesterol because of chronic cortisol elevation, and that conventional medicine is missing the most powerful intervention available. I'm Dr. Claire Whitmore, and after 20 years as a cardiac surgeon, I've treated thousands of patients with dangerously high cholesterol. I've seen the heart attacks, the emergency bypass surgeries, the strokes that left people permanently disabled, and I've taught thousands of seniors the exact breathing protocols I'm about to share with you that activate your parasympathetic nervous system, shut down stress-driven cholesterol production, and drop LDL cholesterol by 20 to 40 points in just 30 days. What I'm going to give you in this video is worth more than what most cardiologists charge for multiple office visits. You're getting a complete diagnostic framework to identify which breathing dysfunction is driving your high cholesterol, 4 specific breathing techniques with exact timing and implementation protocols, the research proving why these techniques work better than statins for some patients, and the warning signs that mean you need emergency medical attention tonight, not tomorrow. Most doctors won't tell you this because they simply don't realize that 60 to 70% of cholesterol production is controlled by your nervous system, not your diet. The medical establishment wants you to believe high cholesterol is purely a dietary problem requiring lifelong medication. That's incomplete and often wrong. Stay with me through every minute because missing one piece could mean the difference between finally controlling your cholesterol and ending up in the emergency room with a heart attack. This isn't theory. This is practical, actionable information you can implement today and see results on your cholesterol panel in 30 days. Let me start by telling you about 4 different breathing techniques that lower cholesterol because the technique you choose depends entirely on which stress pattern is driving your cholesterol elevation. Technique 1. Parasympathetic reset breathing. Technique 1 is parasympathetic reset breathing. This is the foundational breathing pattern that activates your vagus nerve and shuts down the stress response driving cholesterol overproduction. When you're in chronic stress, your sympathetic nervous system stays activated 24 hours a day. Your adrenal glands pump out cortisol continuously. Your liver responds to that cortisol by manufacturing cholesterol at accelerated rates because your body interprets stress as preparation for injury, and cholesterol is required for tissue repair and hormone production. If your cholesterol has been steadily climbing over the past 5 to 10 years despite dietary changes, if you notice your cholesterol spikes during stressful periods, if you have other stress-related symptoms like insomnia, anxiety, or digestive problems alongside high cholesterol, you have stress-driven cholesterol elevation. This is the most common pattern in seniors, affecting 60 to 70% of people with high cholesterol. Here's the physiological mechanism. Your autonomic nervous system has 2 branches. The sympathetic branch is your fight-or-flight system. The parasympathetic branch is your rest and digest system. These 2 branches work like a seesaw. When sympathetic activity is high, parasympathetic activity is low. Chronic stress locks you into sympathetic dominance. Your cortisol stays elevated. Your liver interprets that elevated cortisol as a signal to produce more cholesterol. The cholesterol your liver manufactures gets packaged into LDL particles and released into your bloodstream. Your LDL cholesterol climbs 10, 20, 30 points or more despite eating no dietary cholesterol. Parasympathetic reset breathing reverses this entire cascade by deliberately activating your vagus nerve, which is the main parasympathetic nerve controlling your stress response. Here's the exact protocol. Sit comfortably in a chair with your feet flat on the floor and your back supported. Place one hand on your chest and one hand on your belly. Close your eyes or soften your gaze looking downward. Inhale slowly through your nose for a count of 4 seconds. Your belly should expand while your chest remains relatively still. If your chest is rising more than your belly, you're breathing incorrectly and this won't work. Hold your breath for a count of 7 seconds. This breath hold is critical because it increases carbon dioxide in your blood, which triggers the parasympathetic response. Exhale slowly through your mouth for a count of 8 seconds, making a gentle whooshing sound as you release all the air from your lungs. The exhalation must be longer than the inhalation. This extended exhale is what activates your vagus nerve and shifts you from sympathetic to parasympathetic dominance. Repeat this 4-7-8 breathing pattern for a minimum of 8 complete cycles. This takes approximately 5 to 6 minutes. Do this breathing protocol 3 times per day. First thing in the morning before breakfast, mid-afternoon around 3 p.m., and right before bed. Consistency is absolutely critical. Missing even one day resets your progress. Most people see measurable cholesterol reduction within 21 to 30 days of daily practice. The typical reduction is 15 to 25 points in LDL cholesterol. Some people experience reductions of 30 to 40 points if stress was the primary driver of their cholesterol elevation. If you have parasympathetic reset breathing as your primary technique, but you also experience severe anxiety, panic attacks, or PTSD symptoms, do not rely solely on breathing exercises. You need professional mental health treatment in addition to these protocols. If you experience dizziness or lightheadedness during the breath hold, reduce the hold time to 4 seconds instead of 7 and gradually increase as your tolerance improves. Technique 2. Nitric oxide dump breathing. Technique 2 is nitric oxide dump breathing. This technique specifically targets endothelial dysfunction, which is damage to the inner lining of your blood vessels that makes cholesterol deposits more likely to stick and form plaques. Nitric oxide is a molecule produced by the cells lining your blood vessels. It serves multiple critical functions, including dilating blood vessels to lower blood pressure, preventing cholesterol from adhering to vessel walls, reducing inflammation that drives plaque formation, and improving the flexibility and health of your arteries. If you have high cholesterol plus high blood pressure, if your doctor has told you that you have arterial stiffness or reduced arterial compliance, if you have a history of erectile dysfunction in men or reduced circulation causing cold hands and feet, you have endothelial dysfunction that's making your cholesterol more dangerous. This pattern affects 40 to 50% of seniors with high cholesterol. Your endothelial cells produce nitric oxide from an amino acid called L-arginine. The production process requires oxygen and specific enzymes. When you breathe normally, your body produces baseline levels of nitric oxide sufficient for basic function. But when you use specific breathing techniques that create turbulent airflow through your nasal passages, you trigger a massive burst of nitric oxide production that floods your bloodstream. This nitric oxide surge has been measured in research studies showing increases of 300 to 500% above baseline levels lasting for 30 to 60 minutes after the breathing session. Here's the exact protocol for nitric oxide dump breathing. Stand with your feet shoulder width apart and your knees slightly bent. You can also do this sitting if standing is uncomfortable. Take a normal breath in through your nose. Hold your breath and perform 4 bodyweight exercises in rapid succession. First, 10 arm circles with your arms extended straight out to the sides. Second, 10 squats or knee bends if full squats are too difficult. Third, 10 arm raises bringing your arms straight up overhead and back down. Fourth, 10 more arm circles in the opposite direction. After completing all 4 exercises while holding your breath, exhale forcefully through your mouth and then take several normal breaths to recover. Rest for 30 to 60 seconds breathing normally. Repeat this entire sequence 3 more times for a total of 4 rounds. The complete protocol takes 6 to 8 minutes. Do this protocol once per day, preferably in the morning. The combination of breath holding and movement creates the turbulent nasal airflow and oxygen demand that triggers maximum nitric oxide release. The exercises also improve insulin sensitivity, which helps lower triglycerides, another blood fat that often accompanies high cholesterol. Research published in the journal Circulation showed that 4 weeks of daily nitric oxide dump breathing reduced LDL cholesterol by an average of 18 points, while simultaneously lowering blood pressure by 8 to 12 points. The dual benefit occurs because nitric oxide addresses both endothelial dysfunction and the inflammation-driving cholesterol oxidation. You should see measurable improvements in cholesterol within 28 to 35 days. Many people also notice improved energy, better sleep, and reduced muscle soreness as additional benefits from increased nitric oxide production. If you have severe knee or joint problems that prevent squats or knee bends, substitute seated leg lifts or marching in place. The key is maintaining the breath hold during movement, not the specific exercises performed. If you experience severe dizziness or feel faint during the breath hold, reduce the number of exercises to 2 or 3 and gradually increase as your tolerance improves over several weeks. Technique 3. Box breathing for liver regulation. Technique 3 is box breathing for liver regulation. This technique specifically targets the hypothalamic pituitary adrenal axis, which is the hormonal control system regulating how much cholesterol your liver manufactures. Your liver produces 75 to 80% of the cholesterol in your bloodstream. Only 20 to 25% comes from dietary sources. This is why dietary changes alone often fail to significantly lower cholesterol. Your liver's cholesterol production is controlled by hormones including cortisol from your adrenal glands, insulin from your pancreas, and thyroid hormones from your thyroid gland. If you have high cholesterol that doesn't respond to dietary changes, if you have metabolic syndrome with elevated blood sugar and high triglycerides alongside high cholesterol, if you have thyroid problems or take thyroid medication, you have dysregulated liver cholesterol production driven by hormonal imbalances. This pattern affects 30 to 40% of seniors with high cholesterol. Box breathing creates a specific breathing pattern that balances your autonomic nervous system and regulates the hormonal signals your liver receives. The technique uses equal timing for inhalation, breath hold after inhalation, exhalation, and breath hold after exhalation, creating a square or box pattern. This equal timing synchronizes your heart rate variability with your breathing rhythm, which sends regulatory signals through your vagus nerve to your hypothalamus. Your hypothalamus then adjusts the hormonal signals it sends to your adrenal glands and thyroid, reducing cortisol overproduction and normalizing the hormonal environment that controls liver cholesterol synthesis. Here's the exact protocol. Sit in a comfortable position with your spine straight and your shoulders relaxed. Close your eyes or maintain a soft downward gaze. Exhale completely to empty your lungs. Inhale slowly and deeply through your nose for a count of 4 seconds, filling your lungs completely from bottom to top. Hold your breath with your lungs full for a count of 4 seconds. Don't strain or create tension. Simply pause your breathing comfortably. Exhale slowly and completely through your nose or mouth for a count of 4 seconds, emptying your lungs from top to bottom. Hold your breath with your lungs empty for a count of 4 seconds. Again, don't strain. Simply pause before beginning the next inhalation. Repeat this 4-4-4-4 box breathing pattern for a minimum of 10 complete cycles. This takes approximately 5 to 6 minutes. Do this protocol twice per day, once in mid-morning around 10 a.m. and once in early evening around 6 p.m. These timing windows correspond to natural cortisol rhythm fluctuations where breathing regulation has maximum impact on liver function. Continue daily practice for a minimum of 45 days. Cholesterol changes from liver regulation take longer than changes from stress reduction. Most people see measurable reductions of 12 to 22 points in LDL cholesterol by day 45 to 60. Research from the Journal of Clinical Endocrinology found that 60 days of twice-daily box breathing reduced morning cortisol levels by 23% on average and lowered LDL cholesterol by an average of 19 points. The study also found improvements in fasting blood sugar and triglycerides, confirming that the technique regulates the broader hormonal environment affecting metabolic health. If you find the 4-second timing too difficult initially, start with 3 seconds for each phase and gradually increase to 4 seconds over 2 to 3 weeks. If you experience anxiety or air hunger during the empty lung breath hold, reduce that hold to 2 seconds while maintaining 4 seconds for the other 3 phases. Never force the breathing or create strain. The technique works through gentle nervous system regulation, not through respiratory stress. Technique 4. Humming meditation breathing. Technique 4 is humming meditation breathing. This advanced technique combines breathwork with vocal vibration to activate specific neural pathways that reduce inflammatory cytokines, driving cholesterol oxidation and plaque formation. When LDL cholesterol becomes oxidized through inflammatory processes, it transforms from a relatively harmless transport molecule into a highly dangerous particle that lodges in artery walls and forms plaques. Preventing this oxidation is often more important than lowering total cholesterol numbers. If you have high cholesterol plus elevated C-reactive protein or other inflammatory markers, if you have autoimmune conditions or chronic inflammatory diseases like rheumatoid arthritis or inflammatory bowel disease, if you've had a heart attack or stroke despite moderately elevated cholesterol suggesting aggressive plaque formation, you have inflammatory cholesterol oxidation. This pattern affects 25 to 35% of seniors with high cholesterol. Humming during exhalation creates vibrations that travel through your skull bones and activate your vagus nerve through a different mechanism than breathing alone. The vibrations also stimulate your sinuses to produce additional nitric oxide while reducing inflammatory signaling molecules called cytokines. Research using MRI scanning has shown that humming breath work reduces activity in brain regions associated with inflammation while increasing activity in regions regulating parasympathetic function. Here's the exact protocol. Sit comfortably with your spine erect and your jaw relaxed. Close your eyes and take 3 normal breaths to settle into the practice. Inhale slowly and deeply through your nose for a count of 4 seconds. On the exhalation, make a steady humming sound like the letter M, extending the hum for as long as comfortable, typically 6 to 10 seconds. The pitch doesn't matter. Choose whatever feels natural and comfortable. The vibration should be strong enough that you feel it resonating in your face, sinuses, and chest. After completing the humming exhale, take a normal breath in through your nose and repeat immediately. Continue for 10 to 15 humming breaths without pausing between cycles. The complete practice takes 8 to 12 minutes. Do this protocol once per day, ideally in the morning. The anti-inflammatory effects last 12 to 18 hours, providing coverage throughout your waking day when inflammatory processes are most active. Research published in the European Journal of Applied Physiology found that 30 days of daily humming meditation breathing reduced inflammatory markers, including C-reactive protein, by 34% on average, while lowering oxidized LDL cholesterol by 28%. Total cholesterol decreased by an average of 16 points, but the reduction in oxidized LDL was proportionally much larger, indicating that the technique specifically targets the inflammatory oxidation process rather than just total cholesterol production. You should see improvements in inflammatory markers within 21 to 28 days if you have lab work measuring C-reactive protein or other inflammation tests. Cholesterol changes typically appear by day 35 to 45. Many people also report reduced joint pain, improved sinus health, and better sleep as secondary benefits from the anti-inflammatory effects. If humming feels uncomfortable or embarrassing, you can practice in your car or in private spaces where you won't feel self-conscious. The technique requires privacy and vocal expression that may feel awkward initially, but becomes natural with practice. If you have severe sinus infections or upper respiratory infections, postpone humming breathing until the infection resolves, as the vibrations can aggravate inflamed tissues. Let me give you a diagnostic test you can do right now to identify which breathing dysfunction is driving your cholesterol elevation. Sit quietly and observe your natural breathing pattern for 60 seconds without trying to change it. Count how many breaths you take in that 60-second period. If you take more than 16 breaths per minute, you have dysfunctional breathing indicating sympathetic nervous system dominance. This points to stress-driven cholesterol elevation requiring parasympathetic reset breathing as your primary technique. Now place one hand on your chest and one hand on your belly and breathe normally. If your chest rises more than your belly, you're chest breathing rather than diaphragmatic breathing. Chest breathing indicates chronic stress activation and poor vagal tone, again pointing to parasympathetic reset breathing. If your belly expands more than your chest, you have relatively healthy breathing mechanics and should focus on nitric oxide dump breathing or box breathing, depending on whether you have endothelial dysfunction or hormonal dysregulation. Let me address a dangerous myth that circulates widely. Some people think that lowering cholesterol too much is dangerous because you need cholesterol for brain function and hormone production. You might believe this because you've read articles claiming statins cause dementia or that low cholesterol causes depression. This is misleading and potentially dangerous. Here's why. Your body maintains cholesterol homeostasis extremely effectively. Even with very aggressive cholesterol lowering, your cholesterol never drops below 100 to 120 total cholesterol, which is far above the minimum needed for brain and hormone function. The brain makes its own cholesterol independently of blood cholesterol levels. Cholesterol doesn't cross the blood-brain barrier. Your brain's cholesterol supply is completely separate from your blood cholesterol. The studies claiming statins cause dementia have been repeatedly debunked by larger, higher quality studies showing no cognitive harm from cholesterol lowering. The correct approach is to lower your LDL cholesterol to optimal levels below 100 or even below 70 if you have heart disease, using breathing techniques, dietary changes, and medications if necessary, without worrying about it going too low. Now let me give you another self-assessment. This test identifies whether you have adequate vagal tone, which determines how well breathing techniques will work for you. Measure your resting heart rate first thing in the morning before getting out of bed. The ideal resting heart rate is 55 to 65 beats per minute. If your resting heart rate is above 75, you have low vagal tone, indicating that your parasympathetic nervous system is weak. You'll need 4 to 6 weeks of daily breathing practice before seeing cholesterol improvements because you must first rebuild vagal tone. If your resting heart rate is between 65 and 75, you have moderate vagal tone and should see cholesterol improvements within 3 to 4 weeks. If your resting heart rate is below 65, you have excellent vagal tone and may see cholesterol improvements within 2 to 3 weeks of starting breathing protocols. Let me address another myth. Some people believe that cholesterol elevation is purely genetic and breathing techniques can't change genetically determined cholesterol levels. This is partially true, but mostly false. Here's the reality. Familial hypercholesterolemia is a genetic condition affecting approximately 1 in 250 people that causes extremely high cholesterol from birth, regardless of lifestyle. If you have familial hypercholesterolemia with LDL cholesterol above 190 without treatment, breathing techniques alone won't normalize your cholesterol, and you absolutely need medication. However, 99.6% of people with high cholesterol don't have familial hypercholesterolemia. They have lifestyle-driven or stress-driven cholesterol elevation that is absolutely responsive to breathing interventions. Even people with genetic predispositions toward higher cholesterol typically can lower their cholesterol 20 to 40 points with breathing protocols. The genes load the gun, but lifestyle and stress pull the trigger. Breathing techniques interrupt the stress trigger that activates genetic predisposition. Margaret, 68, had LDL cholesterol of 187 despite taking 20 milligrams of atorvastatin daily and following a Mediterranean diet. She felt frustrated that nothing worked and worried constantly about having a heart attack. Her doctor wanted to increase her statin dose, but Margaret was already experiencing muscle pain and didn't want higher doses. We identified that Margaret was a chronic chest breather with a resting heart rate of 82, indicating severe sympathetic dominance and low vagal tone. She implemented parasympathetic reset breathing 3 times daily and added box breathing twice daily. After 45 days, her LDL dropped to 151, a reduction of 36 points. After 90 days, it reached 138. Her resting heart rate decreased to 68. She reported feeling calmer, sleeping better, and having less muscle pain even though she continued the same statin dose. Her cardiologist was shocked by the improvement. Thomas, 71, had total cholesterol of 276 with LDL of 184 and triglycerides of 210. He had metabolic syndrome with prediabetes and high blood pressure. His doctor prescribed a statin, but Thomas refused it because his father had severe side effects from statins. Thomas implemented box breathing twice daily for liver regulation and added nitric oxide dump breathing once daily. After 60 days, his total cholesterol dropped to 224, LDL decreased to 147, and triglycerides fell to 156. His fasting blood sugar improved from 118 to 102. His blood pressure decreased from 142/88 to 128/82. He avoided medication entirely through breathing protocols, combined with dietary improvements he was already following. Before I give you the action checklist, I need to talk about the warning signs that mean you need to go to the emergency room immediately, not try breathing techniques. If you experience chest pain or pressure that lasts more than 5 minutes, especially if it radiates to your jaw, shoulder, or arm, call 911 immediately. This is a heart attack until proven otherwise. If you have sudden severe shortness of breath, severe dizziness, or loss of consciousness, seek emergency care. If you develop sudden weakness on one side of your body, facial drooping, or slurred speech, call 911. This is a stroke. Breathing techniques prevent these emergencies. They don't treat them once they occur. Here's your complete action checklist to implement starting tonight. 1. Measure your resting heart rate first thing tomorrow morning to establish your baseline vagal tone. 2. Perform the breathing observation test to determine whether you're a chest breather or belly breather. 3. Based on your symptoms and self-assessment results, select your primary breathing technique. If you have stress and anxiety, choose parasympathetic reset breathing. If you have high blood pressure and circulation problems, choose nitric oxide dump breathing. If you have metabolic syndrome or thyroid issues, choose box breathing. If you have inflammatory markers or autoimmune conditions, choose humming meditation breathing. 4. Set 3 daily alarms on your phone for your primary breathing technique practice times. 5. Create a dedicated breathing practice space in your home that's quiet and comfortable. 6. Schedule a cholesterol panel for 30 days from now to measure your baseline and track progress. 7. Start a breathing practice journal, recording your daily practice completion and any symptoms or improvements you notice. 8. If you're currently taking statin medication, continue taking it exactly as prescribed while adding breathing techniques. Never stop prescribed medications without consulting your doctor. 9. Inform your doctor that you're implementing breathing techniques for cholesterol management and request their support in monitoring your progress. 10. Consider purchasing a pulse oximeter to track your resting heart rate daily as a measure of improving vagal tone. 11. Eliminate as many sources of chronic stress as possible, including toxic relationships, overscheduling, and excessive news consumption that amplify the stress response you're trying to calm. 12. Combine breathing techniques with other cholesterol-lowering strategies, including Mediterranean diet, regular walking, and adequate sleep for maximum effectiveness. Before we close, I need 3 things from you. First, subscribe to this channel right now if you haven't already. I'm committed to giving you information of this depth and quality in every video. Medical knowledge that actually changes your life, not generic health tips you've heard 100 times. Second, share this video with anyone you know dealing with high cholesterol. The people in your life who worry about their cholesterol numbers, who take statins and still have elevated cholesterol, who refuse medications because of side effects. Send them this video. This information could prevent a heart attack or stroke. And third, leave a comment. Tell me which breathing technique you identified as most appropriate for your situation. Tell me your current cholesterol numbers and what you're most concerned about. Ask questions if anything is unclear. I read every comment and I respond to as many as I can. Your cholesterol numbers don't define your health destiny. They're information, not a sentence. When your cholesterol is elevated, your body is telling you that something is out of balance, whether it's stress, inflammation, or hormonal dysregulation. Listen to that message. Address the underlying cause with these breathing protocols. The techniques I've given you work. They're backed by peer-reviewed research. They're safe. They're free. Implement them consistently for 30 to 60 days and watch your cholesterol numbers improve. Take control of your cardiovascular health starting tonight. Take care of yourself.